And welcome back to the Daily News. With us now is Dr. Kuykendall and Thom Filicia. We're talking about a cancer disease, a blood cancer disease. It's called myelofibrosis. So I'm going to begin with you, Dr. Kuykendall. Welcome. I know you all are in New York City, but let's just dive right in. And Dr. Kuykendall, tell us a little bit about this rare blood cancer disorder.
Yeah, absolutely. Thanks for having us. So, myelofibrosis is actually a rare blood cancer, as you mentioned, and really it's part of a group of diseases we call myeloproliferative neoplasms, or MPNs. And in this group of diseases, blood cells are overproduced. So you're trying to make too many blood cells, and these blood cells come from the bone marrow. And in the setting of myelofibrosis specifically, this overproduction leads to the buildup of inflammation and scar tissue, which we call fibrosis. And this creates a really inhospitable environment in the bone marrow to make blood cells appropriately. And so patients may show up making too many of some blood cells, not enough of others. And when you can't make blood cells appropriately in the bone marrow, oftentimes you start to make them in other organs, and specifically the spleen can become involved. So you start making more blood cells in the spleen. It leads to enlargement of the spleen, abdominal pain, and symptoms that come with that. And patients also can experience inflammatory symptoms, fevers, chills, night sweats, bone pain. And this can be a real challenge for patients because it is what's unique about this disease is that every patient has different symptoms. So that no one patient is the same as the other. And it can create a really scary time for patients when they get this diagnosis, don't know where to turn, and have symptoms that they're not sure if it resembles the patients they're hearing about. And so that's what the Mapping Myelofibrosis Initiative is, and mappingmf.com is a website that allows you to go there, hear patient stories, hear physicians talk about this disease. It's a great place to go for educational tools, resources, and really get a sense of community, whereby patients can really become their own advocate in navigating this disease.
It affects about 25,000 people in the United States a year. And Thom, your brother was diagnosed with this disease. And tell me about your relationship, and that you actually donated some of your own bone marrow to help him. And how is he doing?
Well, first of all, yes, he was diagnosed with myelofibrosis 10 years ago, and it was a huge surprise. We did not see this coming, and we didn't really know anything about it. And it was very hard to get any information about myelofibrosis at that time. And I was then pretty quickly identified as his bone marrow donor, which was really fortunate. And we started down that path. But it was a really scary time because we had very little information and really didn't understand a lot about what myelofibrosis was, or what sort of the stories of people having gone through it or hearing from other doctors or anything like that. And that is why I've teamed up with GSK on this Mapping Myelofibrosis Initiative, because specifically the mappingmf.com website, which brings educational tools, just knowing what myelofibrosis is, the resources, stories from doctors and patients and other people that are supporting people going through this process, and really sort of creating a community of so that there can be that sort of understanding and that knowledge, which is really, I believe, is really important.
Absolutely. And what are some of the symptoms? We have about a minute left. Very quickly, Dr. Kuykendall, that one might...
Yeah, every patient's different. So patients can present some with fevers, chills, night sweats, bone pain, weight loss. Others can present with, abdominal pain and enlarged spleen. Fatigue is a very common symptom, but many are just diagnosed based on routine blood counts being abnormal. And so I think that's what's unique about this. Different symptoms for different patients and different treatment plans for different patients. And this is what this website and initiative really help us to do, is to put patients in touch with other stories that may resemble theirs and give them that power.
Well, thank you both for being with us and really enlightening us as to myelofibrosis and really what it is and the importance of understanding the symptoms, the signs, and how you can help. So go to the website. Thank you, gentlemen. I appreciate you being on
Thank you so much.
Yes.
Thank you so much. Really appreciate it.
And that's a wrap for this edition of the WHHI Daily News. Thank you all so much for watching. I'm Robyn Zimmerman. And make sure to stay safe and healthy, everyone. And we'll see you next time. Bye-bye.